A 25-year-old female presents to the ER with dizziness. She's holding a bowl and looks very sick. The room started spinning when she turned her head 3 hours ago. She feels nauseous, but hasn't vomited, and her ears feel blocked. She also reports flu-like symptoms 2 weeks ago, and thinks this might all be a stroke. You see that the patient is in a lot of distress, so before you start questioning, offer an antiemetic like cyclizine. Then as usual, get your OD para of the dizziness, the onset, duration, intensity, progression, aggravating and relieving factors. Make sure you clarify with the patient whether she felt like she was about to faint or whether she felt like the room was spinning, as dizziness is a very subjective complaint. Your differentials for this case are broad, so ask 1 or 2 questions about each one. Ask if she has any ringing in the ears, which is quite typical of Meniere's disease. And for benign paroxysmal positional vertigo, ask if the dizziness occurs with change of position. The patient says she thinks this might be a stroke, so ask her why she thinks this, and explain that stroke usually presents with symptoms like weakness and slurred speech. For hereditary conditions like acoustic neuroma, ask if any family members have ever experienced anything similar to what she's experiencing now. Rule out any possible bleeds from trauma or head injury. Ask if she's had any intermittent episodes of visual problems, tingling or numbness in the past that have quickly resolved, that could point towards multiple sclerosis. And ask about any ear pain or fevers for otitis media. Take the vitals, including a lying and standing blood pressure. Do a full neuro exam, and examine the ears using an otoscope, along with a hearing test. You can also consider a Dix-Hallpike maneuver as a diagnostic tool for BPPV. Tell the patient that given the history of flu-like symptoms, the diagnosis is likely to be a viral infection of the nerve responsible for hearing and balance. Reassure that because vestibular neuritis is caused by a viral infection, it is self-limiting and will resolve on its own. Give general advice to get up slowly from lying or sitting, and to drink plenty of fluids. If the patient is still worried, reassure further that she can always be admitted to hospital if her symptoms are so severe that she can't tolerate anything orally. Finally, advise her to stop driving until a follow-up. Offer information leaflets, and inform her that you're going to discuss this case with your seniors.